This is the Rich Dad Radio Show, the good news and bad news about money. Here's Robert Kiyosaki.
Hello, host Robert Kiyosaki, the Rich Dad Radio Show, broadcasting from beautiful Scottsdale, Old Town Scottsdale, Arizona. And our program is about the good news and bad news about the coronavirus. And as you guys know, unless you're living under a rock, it's the biggest news going around. And so I want to find out once and for all, is this coronavirus real or is it fake? The other question is how not to be a victim of it if it is real, but how not to be a victim of it, not just health-wise. I know most people, well, it will never happen to me, and it might not. But how it's going to affect you wealth. So it's about health and wealth versus the coronavirus. And I was watching my friend Jim Rogers, he lives in Singapore, and he flew in for board meetings in New York. And the boards told him, don't come to the meetings. He says, hey, I'm not ill. They said, no, you're from Singapore, so you can't come into the meetings. And he says, so I flew all the way to New York, and I can't go to the meeting. They want me to call in. That's how bad the New York is about this coronavirus. At the same time, I was climbing on a plane from Dallas to Phoenix, and this guy looked like an old biker, real tough guy and all this. And I walked in and I said, hello. I sat down. The first thing, he glares at me and he goes, don't you cough on me. You'd better not cough on me. I said, I'm not Chinese. Don't you cough on me. So lots of stuff going on about this coronavirus. So it's about don't be a victim, health or wealth, whether it's real or fake, because even if it's fake, it still affects the markets and wealth and all that. So we have two experts on this field of health and wealth and coronavirus and your health. One is Dr. Chris Martenson. He's a friend since 2008. He and Adam Taggart are the authors of the book Crash Course. It's a very important book for everybody to read. It's a very important book. It's about what's going on in the world, macroeconomics today. And another guest is my personal doctor. Her name is Dr. Nicole Srednicki. I just call her Dr. Nicole. And she is a doctorally prepared family nurse practitioner who graduated from Georgetown University, magna cum laude, up there with me. No, I was at the bottom of the list. Magna cum laude at the top of the list. But anyway, we have two very smart people who really understand this thing about health and about this coronavirus. And Dr. Nicole is always on me long before this coronavirus. She says, now you be sure to wipe down your seats and your airline trays, because I was in airlines. He says, they're the most filthy things. They're worse than toilets. And I was reading this article, and it said one of the most dirty places in the world is on an airlines. It's that place they keep behind the seat where they put the magazines in. They did this test and where are the most germs hanging out. It's in the magazine rack and behind every aircraft. So those are our two guests today, Dr. Chris Martenson, an old friend, and Dr. Nicole Srednicki. She is a fiancée of my friend, Dr. Radha Gopalan, my cardiologist. So welcome to the Rich Dad Radio Show, Dr. Martenson and Dr. Srednicki. So Nicole, what do you want to start with first? You're always on me, right, about wiping down my tables and all carrying masks and all this stuff, right?
Yes. Well, I commend you on remembering those important words that I tell you. And, you used to roll your eyes, but I think it actually stuck with you.
No, I still roll my eyes. I carry all that stuff you give me. I still don't use it. You know what I mean? But I remember the words.
Well, I am actually sitting in the Miami airport right now, getting ready to fly back to Phoenix. And I am one of the few that is wearing a mask against the CDC recommendations, just because I think I've done enough research and want to protect not only myself, but, I'm back in the office tomorrow with my patients, and I want to, decrease their risk of exposure to anything, because one of the scary things about this virus is that before you even exhibit symptoms, you can be contagious.
Right. Okay, so Dr. Chris Martenson, would you mind giving us your background as you're not a medical doctor, but what kind of doctor are you, and what qualifies you to be one of the leading experts in the world today via YouTube on this coronavirus?
Oh, well, thanks for having me, and it's good to be here with you and Nicole. My PhD is in pathology from Duke University, so I went through, the first 2 years with the med students, and then went a different direction and went to the pathology labs for a bit, and did a postdoc as well. So I got all that science background, and as well, I went out and then later got an MBA. So I translate between the science world and the business world, and really, I've just always had a deep fascination with science and have kept abreast of it. So that's what I'm doing out on YouTube right now, is just trying to translate very complex scientific data for people that, frankly, even the officials are getting really, really wrong. So the so-called people who should be steeped in this, Robert, are given some really bad advice these days. And Nicole touched on one of those, which is they're saying, don't use face masks. And what they're really trying to say is, we don't have enough for everybody. We'd like to preserve them for the healthcare professionals, which I agree with. I just wish they were honest about that.
So Dr. Nicole and Dr. Chris, do you think the coronavirus is real? Because most people think it's fake. It's a Bernie Sanders attempt to get Trump elected.
Yeah, no, it's real. It's real.
Dr. Nicole?
And
yes, I definitely agree with Chris. It is real.
Okay. So what warnings are you on? By the way, how do people access your YouTube videos? What's it under?
You can either search under chrismartenson.com or Peak Prosperity. Either of those will get you to the channel. And, they've gotten millions and millions of views at this point, because I'm just using very plain, simple language, and I'm not trying to either put out there anything that's scary, or I'm not trying to calm people. I'm just saying this is the data that we have, and it's hard to digest because this is the first serious pandemic we've had in 100 years. So I understand why people are struggling with it somewhat, but it's very fast moving. So I'm trying to decode that for people as quickly as I can.
And I thought SARS was a pandemic, or bird flu, whatever it was.
Yeah, Nicole mentioned that the most critical part of this. There's a lot of things that separate this from both flu and the SARS. And so SARS was, it transmitted when it was symptomatic. So if you got it, you would have a fever, you would be coughing. And so it was very easy to stop that disease relative to this one, because you could just, like they're doing at the airports, you could scan for people with temperatures, with obvious symptoms, and then pull them aside, do the contact tracing to find out who they sat near and who they talked to, and isolate everybody. And so it was bad, but it was stoppable. This one has a very long incubation period. We have data out of China that maybe up to 27 days in rare cases, asymptomatic, meaning no cough, no fever, but you got it, and it's infective, and you are infective. So that makes it really, really hard to stop. So it means that everything they're doing to scan temperatures at the airports is good, but insufficient.
So, the problem I have is it's like the boy who cried wolf. You say, well, this is SARS, this is bird flu, this is dog flu, whatever you guys have out there. But after a while, nothing happens, and so people stop paying attention. So in your professional opinion, both Chris and Dr. Nicole, is this more dangerous than SARS or bird flu or dog flu, whatever you got?
What are the things? Yeah. It's more dangerous because it spreads so much more easily. It's got a very, very high infectivity rate. It's called an R0. It might be between numbers. What do these numbers mean? 4 and 7. It just means it spreads super, super fast. And even though SARS was more deadly on a case rate, this is going to infect way, way more people. And so we're already seeing those full-blown outbreaks, epidemics in South Korea, in Iran, in Italy. We saw it on the Diamond Princess cruise ship. It's in Japan. France has got over 100 cases. Germany, United States, it's everywhere. And it's spreading very, very quickly. And that number I mentioned before, the R0, it just tells us it's going to not just spread linearly, but Robert, you'll get this from my work from before, it's growing geometrically or exponentially. Right. And that's the issue. It's really a fast mover.
So, Dr. Nicole, what do you think? Is it more dangerous, hazardous? or is it just another crying wolf?
So, as Chris said, by a case-by-case basis, like a virus like SARS is more deadly, but I think we're going to see many more people infected with the coronavirus. Now, China has been studying the severity of the symptoms, and out of the people infected with COVID-19, 80% of the infections were mild, 15% were severe, and 5% were critical. So what this means is there's a lot of people that are being infected and a lot of people that will continue to be infected, but it's not as lethal as some of, SARS and MERS, which are also both part of the coronavirus family.
So once again, it's Robert Kiyosaki. It's the Rich Dad Radio Show, and we have two experts on this thing called the coronavirus, how it's going to affect our health and our wealth. Because from what I hear is, businesses are shutting down, and Starbucks is closed all through China, and Apple shutting down, and all this. So it's going to be our health also. Our wealth, but also our health. And so that's why we have these two experts on the program. And Dr. Chris Martenson have his MBA, and his book is his Crash Course, and it's about how fast the crash will hit us. And it's always frightened me when I read Crash Courses because Chris uses the example of a football stadium or a sports arena with 100,000 people in it, and how people don't realize what's happening until the last 5 or 6 seconds. And that's the issue with the coronavirus right now, giving us health and wealth, and are you prepared for it? So I have a quick question for the two of you. Who's going to die from it? Are you an old guy who was really weak? Are you dead? Or could anybody die from it? Chris, could anybody die from it?
So,
okay.
Yeah, well, yes, theoretically, but this is a very odd thing. It sets it apart from flu as well, where flu sometimes hits the very old and the very young. This thing is leaving the very young alone completely. There are no recorded serious illnesses from one age of 1 and under, and no deaths under the age of, I think it's still up to like 15 or something. So kids are fine, which is great. But old people, the older you are, the harder it hits you. And it just gets worse and worse as you go up those age brackets. So that's who it's hitting the hardest. And there's, some data. Does it hit men a little harder than women? And we're not sure about ethnicities. It's still a lot of fast-moving data. We don't know. But the rule of thumb is the older you are, the more you want to avoid this thing. Absolutely. Because it's got a very, very high serious complication rate of overall 15%, maybe 20%, depending where we're talking about. So that's something you absolutely, if you want to avoid, which is why we're seeing so many things that are discretionary, like travel, vacations, cruises. All those industries are just like they hit a wall.
So that's why the Democratic Party may lose everybody because they're all old. Bernie Sanders is over 70. And Pete Buttigieg dropped out. So the only young guy dropped out. Anyway, that's not good. Hey, Nicole, what do you think? Does it age have any factor, or health, or what? Who's more susceptible, should I say?
Sure. So definitely the elderly, as Chris said, and anybody that is immunocompromised in any way, or even it's really important to remember chronic illness. So people are at higher risk if they have diabetes, if they're smokers, if they have respiratory issues, heart disease. So they might seemingly be, relatively healthy, but if you do have these comorbidities, it does increase your risk. Pregnant women have to be very careful because we don't have a lot of the data on that, as well as I do think, children, young children, we have to be really careful.
Okay, so then as far as preventative, again, we're focusing on health. Next section we'll go into wealth. But Dr. Nicole, aren't you a vitamin C advocate? Would vitamin C help this at all?
Absolutely. So I love studying about the latest technologies, and, with something like this, it's like we need to know urgently what can we do about it. And, when we look at the recommendations right now, everybody's, CDC and, the health organizations are saying, well, treat it like the flu, and, you need to let your doctor know, and, rest and isolate and hydrate, because there really are no treatments. However, they've really, in China, they've really been driving this hard. And I was reading an article that they have actually been testing a combination of HIV drugs, as well as even they were developing an antiviral for Ebola. They've been utilizing this as a possible treatment measure. And additionally, they have, and this is really exciting for me because I am such a big vitamin C advocate, they've actually been doing some studies in China giving mega doses of intravenous vitamin C for these, not only for acutely infected patients, but also as prevention. And so far, they've had some really good outcomes.
So Chris Martenson, Dr. Martenson, as a pathologist and a toxicologist, what does vitamin C do?
There's a lot of things that it does, and I should, but I bought several kilos of it to have in my own personal supply, just in case around this thing, and I take it prophylactically as part of my health regimen. One of the things that's really bad about this virus is not the virus itself killing you, but it activates your machinery in your body, your cytokine storm, which is your own body fighting the virus, but then going a little haywire and creating a lot of damage. And it creates, as part of that process, it can create a lot of so-called free radicals, which are very damaging molecules that vitamin C helps to sop up and soak up. So I've been reading as well a lot of the antioxidants they're trying, those things. They've got a variety of antivirals that seem to be useful. There's, strangely enough, chloroquine phosphate, which is an anti-malarial drug. It's got some really good promising results around that. So there's hundreds of studies actually going on right now to try and figure out what to hit this with. But vitamin C is absolutely floating up there as something that I'm reading about more and more. And I personally am using that as part of my own health regimen because what's the downside? It's got it's a very safe compound, and it's good for you. And so it feels like something that personally feels good to me to use.
Okay, so once again, Robert Kiyosaki, we're talking about the coronavirus. Not to be a victim of it, either health-wise or wealth-wise. And we come back, we're going into wealth. But now I'm inspired to go to, I'll see Dr. Nicole tomorrow, and she'll give me vitamin C, massive doses through an IV versus a one-a-day vitamin pill. So, ladies and gentlemen, there's things you can do so you don't have to be a victim of this coronavirus, health-wise. Even, so we don't know if it's real or fake, but apparently many people do think it's real. So when we come back, we'll be talking more about what you can do health as well as wealth-wise to not be a victim of this coronavirus. We'll be right back. The subject is the coronavirus. Is it real or is it fake? How not to be a victim of it, especially health-wise and wealth-wise. Our guests today are Dr. Chris Martenson, a longtime friend. He's the author of the book, The Crash Course, with his partner, Adam Taggart. Chris is in Massachusetts. Adam's out in California. And Dr. Nicole Srednicki. She is my personal health physician. And she's got so many credentials. I mean, she's magna cum laude from Georgetown, but she's at the American Academy of Anti-Aging and Regenerative Medicine. But she's also on the board of stem cell stuff. Is that correct, Nicole?
Yes. I love cutting edge medicine.
So that's why I go and see you and all this. So what do you do as far as the stem cells?
So stem cells are amazing regenerative medicine, and I utilize these to treat. I use them as anti-aging. I use them for people with weakened immune systems to help regenerate joints. Stem cells are basically what I call your youth cells, and they go dormant, they get dysfunctional as we age, and we have technologies and protocols to actually basically enliven these cells, and that helps to keep us young, more energized, and feeling great.
Yeah, so people keep asking me now, because I've been seeing Dr. Nicole for about 2 years, is how come you're losing weight and why are you looking younger? Well, it's because of Dr. Nicole. And she's using the leading stuff, which I don't know anything about. There's one big problem with it. It's expensive and it's not covered by insurance. So that's another reason for you to get richer, is because you can get the latest in healthcare versus Obamacare, which means you're going to die. But anyway, so that's Dr. Nicole. What's the name of your company, Dr. Nicole?
Ultra Healthy Human.
And how do they get in contact with you?
They can go to my website, which is www.ultrahealthyhuman.com. I also have an Instagram page. And if you Google me, there's some different podcasts, or they can just call the office.
Good. And the reason I mentioned the thing about the price, because it's not that she's gouging people. The technology she's using are expensive because they're the latest and the greatest. And she was having I'm more the marketing person. I said, your problem is you have poor people calling you up. And the tragedy is the number of poor people is increasing. And they can't afford appropriate health care unless Bernie Sanders gets elected and everybody will have it for free. Anyway, that's it. So Dr. Chris Martenson, again, please give us your credentials as a PhD and da-da-da-da.
Yeah, I got my PhD in pathology from Duke University and
what is
an
pathology?
MBA.
Chris, what is pathology for a layman like me?
Yeah, so it's the study of diseases and disease processes. So we all get sick, and there's a way that happens. And so pathology is looking at how that happens and looking for clues and trying to figure out maybe how sick somebody is or what kind of disease they have. So we're really looking at mostly disease types and disease progression in humans.
So how did you swing into peak prosperity? I mean, you're now in the kind of we're similar venue as Rich Dad. We teach together, we talk together, we share the stage together. But how did you go from pathology and toxicology into finance or money or wealth?
Well, long road, but the short story is the 2000 stock market crash happened. I got curious. I'm a curious guy. I like a lot of data. I started digging, and I started finding things out about how money and the economy worked. I read this great book by G. Edward Griffin called Feature from Jekyll Island, and it totally opened up my eyes to what's going on in the money system. That made me even more curious, so I really started unraveling things. And finally, I came up with a big story about how all of these pieces fit together, and I realized that that's what I wanted to do with my life, was to educate people about these big things I saw so that they could take action to, make their lives happier, better, wealthier, and more resilient.
Yeah, it's a very interesting story. And then by the end of this program, we'll have you tell the story of the super arena, sports arena with 100,000 people and how fast change comes about. So before we go into getting back on, this thing on coronavirus is about health and wealth. So we hear, don't wear the mask, it doesn't help. Yet Dr. Nicole has me carrying these hand sanitizers and all these other goofy things and wearing masks, which I don't wear because I don't want to look like a goofball sitting on a plane. But Dr. Chris Martenson, are masks worth it? Hello?
Are masks worth it?
Yep.
Yes. They are, but they're most worth it if everybody's wearing them, because the best function of a mask is to catch virus particles that are trying to come out of a person's body when they cough or they sneeze or something like that. And if I could be the magic czar and wave my wand, you would see everybody in the United States having a mask on every time they're in public until we get this disease back under control. The mask does limited good to protect you from getting it. It's much better if somebody has a mask on who already has it, so they're not spreading it. And that's, if you go to the hospital, one of the first things they're going to do if you have the flu or they suspect viral or even bacterial contagion from you, they're going to put a mask on you, and that's to protect everybody else from you. And so that's the highest use and best use. Unfortunately, we don't have enough masks in this country right now. We outsourced all of that to China and got caught flat-footed. So we're in a little bit of a bind here until more masks get made. But for now, yes, masks can absolutely help. But in particular, if you have somebody in your home who you think has the flu or maybe this thing, COVID-19, you want to have a mask on them to protect everybody else around them.
So, Dr. Nicole, did you order me my masks?
I have one specially for you, Robert.
Oh, thank you. You know how stubborn I am. And then, you have me using those hand sanitizers, and I just went to see Kim's mother, who's in a hospital. They made me wear a hazmat suit to see her mother. I mean, holy mackerel. She's a 95-year-old woman. I mean, they said, no, you got to put a hazmat suit on and all this stuff and wipe my hands down. And is that worth it, or what's going on? Why does that hand sanitizer? This other guy told me hand sanitizers don't work anyway.
So the best way to to clean your hands is definitely using soap and water. But if you don't have that available, you want a high alcohol based hand sanitizer, and it can definitely help prevent some of the spread. Something additionally that they never talk about, I always tell people to get sanitizing wipes and clean your phone. I mean, people are constantly touching their phones and then eating, touching their phones in the bathroom. I mean, I've walked to the airport and already had to hand over my phone twice to get scanned. And so people's phones are disgusting too. You need to be cleaning your phone off. But as far as, I think when you actually go into the hospital, having those additional precautions, I don't think that's a bad thing, because you're around a lot of illness, you're around people that are immunocompromised. And so taking every precaution in the hospital, I think it's okay to be a little bit more overboard. But as far as, I don't think you need to wear a hazmat suit coming to my office or walking around in public.
Well, you kind of remind me of my friend Donald Trump, because he's a germaphobe like you. He won't shake hands. And
hey, but I don't eat KFC.
But he had to learn how to shake hands to run for president. Anyway, it's kind of funny.
Oh yeah.
So let's go into wealth, and Dr. Chris Martenson. One of the things what do you see happening? But one of the things you're recommending is a person should have like 30 days so that you can quarantine yourself and survive, or something like that. And that's for the health, but also for the wealth. What can you do?
Yeah, so complex story. So we've got lots of content at peakprosperity.com where, just tons of it, because there's three big areas people need to look into. One of them is around their health and sanitation, personal protective equipment. We've been talking about that. As well, they need to safeguard their wealth in this particular environment. As I'm a big fan of your work, and I agree that we're in a huge bubble. And the one thing bubbles hate are pins, and this coronavirus just put the brakes on global manufacturing. It's almost 30% of global manufacturing in China, and it just came to a screeching halt. Huge impact on supply chains. We've already felt some of that with the face masks, but people need to know there's also a supply shock coming for manufactured drugs. That's 97% of our antibiotics come from China. That's a problem. A big chunk of our drugs, and particularly generics, come out of India. Well, they get all their precursor chemicals from China. That's a problem. So we have those sorts of things going on. I think that it's going to be really bad for stocks, because they were pretty expensive anyway. But a supply shock like this is something you can't print your way out of, and lower interest rates don't help. The people need to know about all of that. And then as well, on the other front, if there's only one way to really stop something like this, and that is to put people into basically an isolation protocol. So that's what they did in China. They put everybody in quarantine. They said you can't come out of your house. Only one person can come out every 2 days or every week. It will stop. And so we would advise the people food on hand for at least 30 days, so that if we do go into a quarantine, which could happen, that you at least are resilient and you're able to weather that out better than people who have no preparation. So we advise, yes, and get some good stuff that you would normally eat anyway. We call it a deep pantry. Don't go out there and buy stuff you would never eat. If you don't eat beans and rice, don't go buy beans and rice, right? So But the things that you would normally eat, you should have a full freezer, a deep pantry, and just be ready for that. I think everybody's great grandparents would say, yeah, that's what, you would recognize that's a prudent thing to do. So lots of steps that people can take, that they should take. But let's be clear, we've never seen a shock to the financial system and the manufacturing supply chain like we're experiencing right now. And nobody can really predict what's going to happen. So that's why a little caution, a little prudence is warranted here.
And that's why you said, because we're in right now in March of 2020, and Powell, the head of the U.S. Fed, dropped interest rates another 500 basis points. And what did you see happen?
Well, the S&P shot up about 80 points in 1 minute, and then it lost all of that and more, and it's sort of struggling with that. So this is one of the first times we've seen where the Federal Reserve cut rates and it lasts for a couple of minutes. And it means that, honestly, is a rate cut, let me ask you this way, it's kind of a sarcastic question, but, if the Fed cuts rates 0.5%, are you more likely now to pick up the phone, grab a plane ticket and go hang out at Disney World? Probably not, right? So there's nothing that really the Fed can do by lowering interest rates when we already have the easiest financial conditions. If car loans are 0.5% less, people are hunkered down. They're very worried about this thing. Consumer behaviors have changed radically in the last 2 weeks, and that's something that can't be fixed with, slightly cheaper money. So I think people just need to be ready for that and aware that, the Fed might be out of bullets here.
Right. And what you were saying is that they cut rates, but it can't get the supply chain back up in production. And people are being let off their jobs to stay at home. They go into isolation. I mean, this is a pretty systemic collapse we're coming into. So that's why Dr. Chris Martenson is saying, get 30-day supply. Another thing Chris recommends, which I do, which is why Dr. Nicole and I are such good friends. You have to have friends that you can trust. And I trust I trust Dr. Nicole and her fiance, Dr. Rada. I have cans of antibiotics because they last forever. So it's like I have bullets and I have antibiotics and I have a pantry full of food and I have gold and silver and I have cash outside the bank. And I keep my cars topped up with gas because if this is a systemic problem it's more than just your health. So, Dr. Nicole, what are you doing to prepare for possible collapse or challenges of the system?
So I have been starting to collect physical gold and silver, just as one of something I learned from you is that you call this God's money because, even with all the inflation and, as our money is becoming devalued, that's still real money.
Yeah. What do you mean by that? There's a term called counterparty risk. Chris, you want to explain counterparty risk?
Sure. If I write you a check, you've got a check from me. It's an asset, but I'm the counterparty. And the risk here is, maybe I wrote you a bad check. So our whole financial system is shot through with counterparties, and gold is the only financial asset that I'm aware of that doesn't have any counterparty risk.
That's physical gold.
One trick. Physical gold. That's right. The trick. You have to own it yourself. It's not somebody's not holding it for you. It's not in some vault somewhere with your name on it. It's all of that, right? But if you can hold gold, you actually have real wealth in your hand, and we'll call that money, and we'll separate that from currency. Right? It's just a different thing. Yep. Money is money, and gold is been money for a long time.
Yep. And we also have, in remote places, cash on hand, because if a panic hits, you won't be able to get to the banks. That's what happened in Iceland and Greece and Italy, I think. So that's why we have the Rich Dad Radio Show. It's not that we want these things to happen, but can you be prepared for it? So, Chris, final word on this is the thing in your book, Crash Course, which I recommend everybody read because that was kind of your wake-up call is when the market crashed. It was I think it started around the Asian crisis in 96, 97, 98. But you also have the story about how fast a football or a gladiator stadium with 100,000 people, how fast it fills up with water. Because that really woke me up when I read your book, Crash Course. Could you explain that?
Sure. So the example here is because we're humans, we don't really understand this thing called exponential growth, right? Linear stuff we understand very easily, but exponential stuff. Here's a thought experiment I run, and it starts with a magic eyedropper. And it's magic because the drop of water that comes out of this eyedropper will double every minute. So you put a drop in your hand, 1 minute you have 2 drops, and after another minute you've got 4 drops, and after 5 minutes you can fill a thimble up. So now I'm going to take whoever's listening, we're all going down to a stadium, right? And I'll handcuff you all to the highest row of bleacher seats. Pick the biggest stadium you've ever been in. Just think that through. And we're going to make it watertight. And you're handcuffed up there to that top row of bleacher seats. And now I put one of these magic drops of water down in the middle of the field down there. And it starts to double every minute. And the question is, how long do you have to escape from your handcuffs? And I don't care how big your stadium is. The answer is 50 minutes, 50. You only have 50 minutes to escape. And the troubling part in this story is that it was still 97% empty at 45 minutes in this story, right? So for 45 minutes, not much is happening. There's a little water down there, 5 more minutes, and it's completely full. And that's how exponential or geometric progression works. And this virus is growing exponentially. We watch cases, there's like 1 case, there's 2, then there's 4, then there's 8, and on and on and on. And, it's like case, cluster, boom. We saw that in all the countries that it's been hitting so far. And I think that's coming to the United States at this point.
So and that's why when I talk to Dr. Nicole, there's health and there's wealth. So the reason I have antibiotics and I see Dr. Nicole on a regular basis for my vitamin C drips and other vitamin drips and things like that, and my little pills. And the reason I'm losing weight is I'm not focusing on my weight. I'm focusing on my health, which is different than losing weight. And she's using the latest and greatest in stem cells and all those other latest and greatest medical breakthroughs, which cost money. But the other part I've been saying to her is that when you want gold or silver, it won't be available. Is that right, Nicole?
Yes.
So what happens when the panic hits, exactly what Dr. Chris Martenson is saying, in the last 5 minutes, people will wake up. And then all the gold and silver and cash will freeze up. Does that make sense to you?
Yes.
So
yep.
Is that why you're preparing now versus 5 minutes from now? So what are you doing?
Yes. To parallel this with the coronavirus, what I tell people, you might end up catching the coronavirus, but do you want to be part of that statistic that I mentioned earlier? Do you want to be part of the 80% of mild cases, or do you want to be part of the 15% of severe cases? So we need to be proactive and do things now. And by this, I mean, boosting your immune system. So if you do get this, you can fight it off.
Yeah, well, that's what Dr. Radha Gopal, Nicole's fiance, my personal doctor, says to me. He says, exercise, get your vitamins, stay healthy, because that's the best defense, right?
That's right.
So good. So I want to thank you guys. Thank you, Dr. Chris Martenson. Again, his book is called Crash Course. Please get it. His company is called Peak Prosperity. And Dr. Nicole, I'll be seeing you in a few days for my vitamin drip.
Yes, thanks so much
for having us. Thank you.
Thanks, guys. Really great program. Very informative. So once again, thank you all for listening. We'll be right back and the final recap on the coronavirus and how it's going to affect your health and your wealth. We'll be right back. Welcome back. Robert Kiyosaki, the Rich Dad Radio Show, the good news and bad news about the coronavirus. And we don't want you to be a victim of it. We've got some straight facts on it. And these are from credible people, not me, because I know nothing about disease and all this. One was Dr. Chris Martenson. Again, his PhD in pathology and toxicology. But he also, after he lost everything around the 2000 crash, he realized how much he'd been lied to about finances. So he got his MBA, and then he wrote with Adam Taggart, his partner. And Adam lives in California, and Chris lives in Massachusetts. and they wrote the book called The Crash Course, and they founded a company called Peak Prosperity, and we're like peas in a pod. Rich Dad and Peak Prosperity. We always we're saying the same things. We have slightly different messages, but they're very, very similar. Another is Dr. Nicole Srednicki. She's my personal physician. Her fiance, Dr. Radha Gopalan, and watch after my health. And that's one of the things that Adam Taggart and Chris Martenson talk about. Is you'd better have your team next to you. And then next week, we're going to having part of my team. Kenny McElroy will be in, and possibly Tom Wheelwright, talk about how you protect yourself financially right now. Because I don't know if you know how serious even if it's not the coronavirus, the world economy is hanging by a thread right now. And I meet so many people their heads are so far up there, you know what, they don't even know what's going on. And so that's why we have the Rich Dad Radio Show and Peak Prosperity. And so I want to thank Dr. Nicole, for sharing what they share with me on a constant basis. And again, don't text her at Ultra Healthy Human if you don't have money and you don't have insurance, because her work is extremely expensive simply because the raw materials are expensive. And she's on the American Academy of Stem Cells and American Academy of Anti-Aging and all this. So when people say money doesn't make any difference, it's only your health, idiots. You know what I mean? That's the purpose of this Rich Dad show. And I want to thank Dr. Chris Martenson and Nicole Srednicki. And I want to toss it to my boss in this room, Dr. Sarah. So what did you pick up today, Dr. Sarah?
Well, first, my father would be very proud if doctor were in front of my name, but that just didn't work out the way he'd hoped. So the key to this show, right? Protect yourself. I think with anything, whether it was SARS or whatever, you have to take care of yourself because money doesn't matter if you're dead. So the key is
what's even worse? Money matters if you're sick.
Right.
You can't afford to be sick.
Right. That's a good point.
It's horrifying. Go ahead. Keep going.
So I think the key to this is protect yourself, wash your hands, wipe down your surfaces if you're out in public, like Nicole had suggested for you on the airplane. Wear your mask. I think there's a little bit of debate still on whether we should be wearing those or not, but do what you can to protect yourself. Now. And then ultimately with what we're seeing in the markets happening, going up and down every single day, we just hit all-time highs last week or on Monday and then
all-time lows.
Right. So it's going up and down. So I think the key is protect your health and you've got to protect your wealth.
Correct. And so you think about this, if it's true, but my friend Jim Rogers, who wrote the book Investment Biker, he's one of my heroes, smartest guys I know. When the stock market was down and he was buying gold. So that's why I was kind of quizzing Dr. Nicole, because I'm encouraging her to get out of saving money and buying gold and silver, God's money. She says, well, it wasn't time. I said, but the thing is, this is the point. It was really low.
Yeah.
I mean, and so when the smartest guys I know, like Jim Rogers, says, I'm buying gold right now because it's low. Mm-hmm. And what people do is they wait. I think that's the problem.
I think they wait because they think of it as like the stock market in the sense, I'm waiting for the big crash. And that's not going to happen with gold.
Well, you never know. That's
right.
The problem.
Well, and like you always say, gold is a hedge against,
crash.
Right. So I think everybody should, and like we've talked about in other millennial money episodes, silver's the cheapest asset you can buy right now. Why wouldn't you be stockpiling as much as you could, in my opinion?
Right. And when you look at some of the reports I see, and this is Jim, all of my friends say the same thing. We got so much fake money sitting out there. They printed, I think, $4 trillion and stuff like this. And the amount of available gold and silver keeps going down. And why does it keep going down? Because people like myself and Records and Jim Rogers were hoarding it.
Yeah.
It's no different than me stockpiling antibiotics and bullets and guns and toilet paper and food. You know what I mean?
I was at Costco yesterday, and it was like we were running out of water tomorrow. People had cases upon cases in their carts, and there's severe panic happening right now.
Yeah.
But I think you just have to do the best you can do and take care of yourself.
Yeah, before it happens. Do you remember, you're probably too young, but there was a thing called Y2K.
Oh,
remember that?
yeah. Mm-hmm. I turned 20 that year.
You're 20 because you're old enough to remember. But, I'm Sarah knows me, I'm computer illiterate. And so I didn't know what this Y2K, I had no idea what they're talking about, what is Y2K. Mm-hmm. But since I didn't know, I just went down to Costco. I rented storage lockers, and I loaded it full of food. I just bought all this food, canned goods, water, and all this stuff, and I just stuffed it in this storage locker. It cost me $30, plus the food was about $1,000. And the moment Y2K passed, I simply took all of that food down to the food bank and got a tax deduction for it. But I was ready for it.
Right.
And I think that's kind of the message here, is because it's like gold and silver. I've been saying to Nicole, the moment people catch on that they have to have it, there's none available.
Yep.
And the same as toilet paper or masks. It's not available.
Yeah.
And,
Chris Martenson mentioned in the show, there's not enough masks in the U.S. For everybody. And then I was listening to another show just yesterday morning, and they were saying the problem with masks, and most people aren't even educated how to use them, which you would think is simple to put on, but they're dirty then on the outside. So you have to get rid of them often. You can't rewear them. You don't want to be touching your face because that's what's
like
blocking.
Toilet paper.
Yeah. But people don't think about it. They'll just keep rewearing it. So all they are is touching their, whatever dirty was on the outside is now touching your face.
Yeah. And I thought this is what Chris says. The Surgeon General says masks don't protect you. And what he knows is that there's not enough for the health practitioners. Mm-hmm. So that's why he's telling the public not to get it.
Right.
And I don't know if that's true or not, but it sounds possible.
It's possible. Yeah. Everything. Yep.
So remember, the reason I asked Chris to tell the story about that stadium, let's say it takes 15 minutes, you don't even see the water until 45 minutes, and then it's finished. Yep. And that's why he's the math genius in this whole thing. So, ladies and gentlemen, that's the thing with the coronavirus. Don't be a victim, health or wealth. So thank you, Sarah.
Thank you.
And thank you all for listening to the Rich Dad Radio Show. And thank you again to Dr. Chris Martenson and Dr. Nicole Srednicki.